Have you ever wondered why prostate cancer is often referred to as a silent killer? This is a question that might have crossed your mind, and today, we're going to shed some light on it. Prostate cancer, a disease that affects millions of men worldwide, is indeed known as a silent killer. But why is that? You see, in its early stages, prostate cancer often shows no symptoms. It's like a stealthy invader, quietly setting up camp without tripping any alarms. This makes it incredibly difficult to detect until advanced and started causing visible problems. Now you might be thinking, that sounds pretty scary, and you'd be right. But it's not all doom and gloom. While the silent nature of prostate cancer can make it seem like a monstrous, unstoppable force, the truth is that it's not invincible. In fact, when detected early, the prognosis is usually very good. And that's why regular checkups are so crucial. Regular checkups are like our secret weapon against the silent killer. They give us the chance to spot the disease in its earliest stages, when it's still relatively easy to manage. Imagine it this way. If prostate cancer is a sneaky intruder, then regular checkups are like a top-notch security system, helping us catch the intruder before they can do too much damage. So, while prostate cancer might be a silent killer, it's not an unbeatable one. With regular checkups and a good understanding of the disease, we can fight back. We can turn the tide in our favor and keep ourselves healthy and thriving. But understanding is key. To truly stand against this silent threat, we need to know more about it. We need to understand its causes, recognize its symptoms, and be aware of the treatments available. So, to understand this silent threat better, we need to dive into the causes, symptoms, and treatments of prostate cancer. Stay tuned as we continue this journey of understanding and empowerment. And don't forget, if you found this video informative and want to learn more about such topics, please subscribe to our channel. Your subscription will ensure you never miss out on our valuable health content. What triggers the onset of prostate cancer? It's a question that has puzzled researchers for years. So let's dive into the known causes of this disease and how certain factors may increase the risk. First off, age plays a significant role. The chances of developing prostate cancer increase as men get older. In fact, over 65% of all prostate cancers are diagnosed in men over the age of 65. Race is another factor. Statistics indicate that prostate cancer is more prevalent in certain racial and ethnic groups. For instance, African American men tend to have a higher risk than their Caucasian counterparts. However, the reasons behind these racial disparities remain a mystery. Family history is another crucial piece of the puzzle. If your father or brother had prostate cancer, your risk might be doubled, even tripled. It's an alarming fact, but it's important to remember that many men with a family history of the disease will never develop it themselves. Now let's talk about diet. Some studies suggest that a diet high in red meat or high-fat dairy products may contribute to an increased risk of prostate cancer. Conversely, a diet rich in fruits, vegetables, and fish might lower the risk. Then there's the matter of lifestyle. Regular physical activity and maintaining a healthy weight may help reduce the risk of prostate cancer. Chemical exposure is another potential risk factor. Certain occupations like farming, tire plant work, or painters, where there is a likelihood of exposure to chemicals, have been linked to a higher risk of developing the disease. And lastly, a few studies suggest that men with certain sexually transmitted infections, STIs, like gonorrhea or syphilis, may have a slightly higher chance of developing prostate cancer, but more research is needed to confirm this. While these factors increase the risk, they don't guarantee the disease, which is why understanding symptoms is equally important. So, as we navigate this complex topic, remember, knowledge is power. Armed with the right information, we can better understand, prevent, and fight prostate cancer. Recognizing the symptoms of prostate cancer can be tricky, especially in the early stages. Yet being aware of the potential signs is a crucial step in early detection. So let's familiarize ourselves with them. Firstly, urinary problems are commonly associated with prostate cancer. This may include an increased need to urinate, particularly at night, or difficulty starting or maintaining a steady stream. You might also experience a burning sensation during urination or see blood in your urine. These issues arise because the prostate gland, which is involved in urine control, may get affected by the cancer. Next, let's talk about sexual dysfunction. Prostate cancer can interfere with your sexual health, leading to problems such as erectile dysfunction or a decrease in sexual desire. It's important to remember that these symptoms can also be caused by other conditions or age-related changes. But if you notice a sudden or drastic change, it's worth discussing with your doctor. Pelvic discomfort is another symptom to be aware of. This can range from mild discomfort to severe pain in the pelvic area or lower back. Prostate cancer can sometimes spread to the bones, causing pain and discomfort. Again, it's important to note that these symptoms can be caused by other, less serious conditions, but they deserve medical attention nonetheless. The last symptom we'll touch on is unexplained weight loss. If you find yourself losing weight without trying, it may be a sign of prostate cancer or other health issues. Unintended weight loss can also be accompanied by fatigue or a general feeling of being unwell. But remember, having these symptoms doesn't necessarily mean you have prostate cancer. They could be caused by other health conditions or even just normal aging. However, experiencing any of these symptoms should prompt a visit to your doctor. It's always better to be safe than sorry, and early detection can make a world of difference. Remember, early detection is key in the fight against prostate cancer, and that starts with recognizing the symptoms. Thankfully, medical advancements have provided us with several treatment options for prostate cancer. These treatments are designed to not only combat the disease but also to maintain the quality of life for the patient. One such treatment is surgery. This is often chosen when the cancer is confined to the prostate. A radical prostatectomy involves removing the entire prostate and some surrounding tissue. Laparoscopic and robotic-assisted surgeries are less invasive options, with quicker recovery times and fewer complications. Next, we have radiation therapy. This uses high-energy rays or particles to kill cancer cells. There are two main types: external beam radiation, which is delivered from outside the body, and brachytherapy, where radioactive seeds are implanted directly into the prostate. Hormone therapy is another treatment option. Prostate cancer cells usually require male hormones like testosterone to grow. Hormone therapy reduces the body's ability to produce these hormones, effectively starving the cancer cells. Chemotherapy, often used when the cancer has spread outside the prostate, employs drugs to kill rapidly growing cells, including cancer cells. It can be administered through a vein in your arm, in pill form, or sometimes both. Finally, there's immunotherapy. This is a treatment that uses your immune system to fight cancer. It uses substances made by the body or in a lab to improve or restore immune system function. The best treatment option depends on various factors, such as the stage of the disease, the patient's overall health, and the potential side effects of the treatment. It's important to have open discussions with your healthcare provider to decide on a treatment that suits your individual needs. Remember, the goal of any treatment is not just to eliminate the cancer, but also to maintain your quality of life. This includes managing side effects and preserving urinary and sexual function. While these treatments can be effective, the journey doesn't end there. Recovery and follow-ups are just as crucial. Now that we've discussed the causes, symptoms, and treatments of prostate cancer, let's summarize what we've learned. Prostate cancer, often considered a silent threat, is a disease that primarily affects men, particularly those over the age of 50. The exact cause of prostate cancer remains unknown, but we know that factors such as age, family history, and race can increase the risk. We've also touched on how this disease is often asymptomatic in its early stages, making regular screenings crucial. However, when symptoms do occur, they can include frequent urination, especially at night, difficulty starting or stopping urination, painful urination, and even erectile dysfunction. We've delved into the various treatment options, which can range from active surveillance for low-risk prostate cancer to surgery, radiation, hormone therapy, and chemotherapy for more advanced stages. It's important to remember that the choice of treatment is highly individual and depends on a variety of factors, including the stage of the disease, the patient's overall health, and their personal preferences. But what can we do to stay one step ahead of this silent threat? Regular checkups are key. Men over 50 or those with a high risk should consider yearly screenings. And let's not forget the importance of a healthy lifestyle. Regular exercise, a balanced diet, and limiting alcohol consumption can all play a part in maintaining our overall health. And finally, let's remember that while the topic of prostate cancer can seem daunting, it's not a death sentence. Advancements in medical technology and treatments are constantly being made, and the survival rate for prostate cancer is high, especially when detected early. Remember, knowledge is power. Stay informed, stay healthy, and remember to consult your doctor if you have any concerns. After all, prevention is better than cure. So let's keep the conversation going, because awareness is our first line of defense against this silent threat.